Basta salamat at ika'y isinilang. Di pangkaraniwan, para siyang superhero. Hinarap lahat ng pagsubok, yung iba hindi biro. Meron siyang misyon, kaya walang takot sumabak. Mga buhay na nagkasalalay sa kanyang pangarap. Parang pelikula, action, adventure, drama. May konting comedy, love story na pangmasa. Galing sa wala, akala mo talo.
Oh, this is like to give us confidence as practitioner. That, you know, we are confident that what we are doing is based on science, you know, and has the higher rate of effectivity and efficacy. So we teach this to our kids, and also I try to, I always educate the parents of what to do in case of certain injury. Now, you can all, you know, stop me, and if you have questions, you know, please do so. So I'm just gonna continue talking, okay? Now, yes. Our topic is basically broad. Sports injury is basically broad. I mean, you know, it involves a lot of disciplines. You know, there's the sports medicine doctor, orthopedic doctor, you have the rehab services, the nursing, orthopedic, you know, services and stuff. But in our profession here in the US, sports physical therapy is also one certification that you need to study again for a period of 2 years and then get your certification and exams and whatnot. I'm not going into that business right now, because right now what I'm focusing on is to get my certification in sports and conditioning certification as a coach, which I hope to take the examinations sometime in November. So I kind of like studying a lot of that and reading a lot of books and preparing for that. So, you know, as a coach and as a trainer, I'm a lifelong learner. I mean, I guess we all are. I mean, we don't need to stop learning today so that, you know, what we can teach to the kids tomorrow. And so sports injury is very big, right? So what I'm going to try to do is to limit our discussion to basketball, common injury. And right now, I would like to also to limit it to youth basketball injury, because that's where my practice is. But I know, but we have maybe college or professional coaches that is watching. That will be another webinar for you. But right now, what I'm trying to get at is to focus our discussions and my presentations in youth sports. All right, the most common, I mean, we always ask about the most common type of basketball injuries, you know. And if you can read it, you can Google it. The number one is ankle sprain. It's always an ankle sprain. And then there is a knee sprain, all right, hip sprain, shoulder, and fingers and hands. And sometimes also collision. And then there's a different protocol in each aspect, you know. So there was one time when we had a player, like I saw it happen, that he rolled his ankle. Now, most of the time, the ankle injury is will occur in an awkward landing. Okay, that's number one, in an awkward landing. And then secondly, in change of directions. Okay, you can roll your ankle that way. And then some coaches knows about it is if it is a high ankle or low ankle injury. All right, but basically, I mean, you know, it is an injury, you know. And then there was a player that rolled his ankle, and I saw it. I was called, so I immediately ran to him, and there are many people already gathering on the, you know, around that player. So I said, we got to remove the shoes. And then here comes one parent who told me that, like, you know, don't remove it, you know, don't take it off. So which one, I mean, you know, in that kind of situation, you will ask yourself, which one is the right practice? You know, don't take it off or take it off, right? So in my practice, I will take it off. The reason for that is I immediately perform an initial evaluation right away. I would like to see if there's a presence of swelling, or if there's a presence of bone. You know, you will know if it's fractured or just a merely minor sprain, right? So one thing that we do, okay, I always apply the principle of price, P-R-I-C-E. Before it was only rice,
Right.
R-I-C-E. In acute injury or any sports injury, you have to bear in mind these principles. Okay, so price, P is for protection. You got to protect the injured limb right away. And how are you going to do that? Let's say if it's an ankle injury or a knee injury, what you want to do is not to let that player to put weight on that foot, meaning don't walk on it. Okay, so you could use some kind of splinting or bracing if it's available. Okay, so that is for P, and then R is for resting. Okay, now in the Philippines, back in the days when I was younger, when you sprain your ankle, you immediately look for an empty bottle, of
Yeah.
Coke or whatever. And then you will roll it there, roll it, roll it, roll it. Okay, so I don't know if that's still in practice today, but maybe it is in some areas in the
Some
Philippines.
areas.
And sometimes they also try to like step on it, like we call it Tagalog, pagpag. I mean,
Pagpag.
yes, palagpag or pagpag, ginagawa nila yan. So actually, in those kind of strategy, is you're adding more insults to the injury. Okay, there was no basically data that supports that it is really effective. So again, there's no evidence that says that it will basically enhance healing right away, but it's not. So rice is rest. So you rest it. The next one is in the first 24 to 72 hours, you apply ice. Okay, ice pack. Now, in some areas here in the US, they have this cryotherapy where they use some kind of machines, cooling machines, and then you can wrap it around the injured leg, either the knee, the hip, or the ankle. Okay, but in some areas, we don't have that available. Let's say in the Philippines, I mean, what you can do there is like make sure that you have ice pack, put it in a plastic bag, all right? And then you apply it like, for from 15 to 20 minutes. Okay, so 15 to 20 minutes, and then after that, every 2 hours you apply it, but don't apply it directly on the skin. You may want to put some barrier, thin barrier. Okay, you don't want to put it directly on the skin. And then the C is compression. Now, compression is with the use of an elastic bandage, okay, or ACE wrap as we call it. Now, there are different ways of applying it, but basically you apply it with a figure of 8. I was supposed to present this, how to do that figure of 8, but due to my confusion about the time, I was not able to present that this evening. But anyway, so you know what I mean. Maybe it's in the next discussion we will be able to show that. And the E is elevation. All right, elevation is basically raising the limb above your heart. So if it's the leg, all right, you have the player lie down on the floor or anywhere, and then put an extra pillow or whatever that can elevate it above the leg. All right, so that is just the immediate treatment that we can do as a trainer and as a coach. Okay, so what we do in Familia, Washington, D.C., we ask the parents to carry their own ice pack, elastic bandage or ACE wrap, and whatnot, and I will do the rest. All right, so at least because sometimes some sporting events, those are not available or readily available, so it's better to have your own. All right, so those are the immediate treatment that you can do, and after that is you can basically tell the parents to follow through when their player is home. So continue to apply that. All right, if it's just a minor injury, all right, I mean, and then the player will always ask, when can I start playing again? Okay, I always encourage them to look for the swelling if it's down, and then they approach me and I will check it again. Then I ask them to do something for me, okay? If they can run, if they can jump, if they can sprint, then they can start playing. or even practicing. All right, but if not, I mean, I don't want to say, delay the healing process as much as possible. Okay, so that is foremost is my priority, and make sure that your body is ready. Okay, now, so if it's a major injury, let's say a grade 3 ankle sprain, because there are 3 grades of ankle sprain,
Okay.
1, 2, and 3. All right, 1 and 2, you can apply the price, and then probably about, sometimes number 1, they can grade 1 player can play right away. You can just have him rest maybe for a few minutes, and then he can play right away. All right, so they can do that. But grade 2, you have to apply this for 72 hours, the price. And then grade 3, this is the time that you may want to consider to take your player to emergency room for further evaluation. Okay. Even in knee sprain, okay, do the same thing. Do the same thing in evaluation that I do. And I have experience seeing a player upon landing. I saw that the knee just kind of like destabilized or kumawag yung tuhod,
Yeah.
The thigh bone basically move forward. Like if this is the knee, it moves forward like that. So that is like an indication of a cruciate ligament tear, something like that. Okay, but depending on severity and the grade of this anterior cruciate ligament tear, I mean, you can only see that in X-ray or sometimes a CAT scan. In some areas, they don't have that privilege to go to emergency room and have it X-ray and stuff. So what can you do about that? Is basically don't let the player play and apply the price. Okay, apply the price and stuff, and then later on, further evaluation will be necessary if it needs some, surgery. Basically, in anterior cruciate ligament tear, there's like 4 phases. Phase 1. You can do something. This is like the pre-operative phase. Bago operahan, there are some types of exercises that you can do mildly, and then the post-operative phase. All right, and then the third one is just and the fourth is going back to sports. So normally ACL tear, I mean, players can get back to fully participate in their particular sports, let's say basketball, for our, for the period of 6 months, they can play again. All right. But of course, in the phase 3, they should have a very, very good rehab. All right. Now, so those are just a common injury that I encounter in my practice as a trainer and coach in our ball club. Okay, fortunately, we didn't have any really serious injury. All right, but there are sometimes, I mean, banging of heads, contusions and whatnot, but there's always a protocol of how to do that. We're still trying on developing those protocols. It is very important for us coaches to be educated in that aspect, so we will know what to do. Not just coaching, but also to take care of our player, and as well as educate our parents. Sama-sama tayo.
Yeah. Yes.
Anyway, now,
Coach,
prevention
can
program.
I
Go ahead.
have how about you say tell us knee injuries? How about the what you call that, the hamstring?
Yes. Now, in the sports of basketball, hamstring injury is very unlikely. It happens in the other different kind of sports,
Mm-hmm.
Now, it's the same thing that you're gonna see. Is apply the price, right? If you see, okay, hamstring injury, all right, and the player is basically will put his hands on it, right? He would put on hands on the hamstring area, and will say, "Masakit to, masakit to." But you will see, check it right away. Have him lay on his stomach, nakadapa, all right, so that you can compare the injured leg and the uninjured leg and see how it's looking, the bulk of the muscle. If you see that the other one is kind of like more bulky than the other, that means he has a hamstring tear. All right. Now, something you can do about that, okay, is you apply rice right away. Okay. If it's just a minor thing, I mean, you still have to apply the price right away, and then have him do some walking, running, and sprinting before putting him back to the game. Okay, because there are some players who can tolerate that. You know, it is always my advice to them to not to play anymore. You know,
Yeah.
maybe I'm just so conservative about it. Any type of injury, I would just say, don't play it anymore. I mean, you know, just wait for the next game. All right, so you have at least time for me to evaluate you and to make decision whether to send you to emergency room or, you know, just stay there and watch. Okay, so one thing that is also happening, it's some kind of, it's not really an injury, but cramps, right? I mean, you know, this is
Yeah.
very, very prevalent in playing basketball, especially in our scenario here in Washington, D.C. Every time we play in intercity, our kids play with minimum of 3 games. Sometimes it's back to back. Okay, so I'm just asking everybody to be ready. I mean, you know, hydrate yourself 2 weeks prior to the tournament and eat some salt. Kids loves that, eating chips, but not too much because it's not really healthy and, you know, for them. But just, you know, salt, the iodized salt, if you have something like that you can give to the kids, all right? Especially if they're playing outdoors. You know, the temperature is, let's say 100 degrees and above. You gotta do something like that. Or even if there's not good air conditioning in the sporting arena, you know, so make sure that they are hydrated at the same time. Okay, so any more questions about sports injury and basketball injuries that you
Yes,
maybe
yeah.
something try
Yes,
to
coach.
butt in, okay?
Coach, how about what you call that? Because most of the time, when the players are athlete had an injury, it's the time na nagkakaroon sila ng what you call that, nabili sila ng mga protection for it. Yung protection ba before dapat kailangan na or pagkatapos mangyaring yung ano like coach yung mga bandage, like yung tapes.
Mm-hmm. Now, that is basically if Coach Milky, if the player that is playing have a previous injury, okay? If he has only previous injury and he is just returning to the injury, okay, it is highly recommended that he had some kind of protection like ankle brace or knee brace and stuff like that coming back to the injury. But if your player is like healthy 100%, all right, you don't need those protection, you know, because basically he has a body that is conditioned to perform in a higher competition, so you don't need that. But you know, if they have a previous injury of ankle sprain, I would recommend them to have those protection tapings, bracing or kinesio tape, you know, which is widely used now in Olympics and professional basketball and stuff. So you can do something like that. Okay, so we're gonna move now to the prevention program that we do and have implemented in our basketball club, which is Washington, D.C. Now, the challenge for me was because we were only practicing once a week and for 2 hours, right? So I have to come up with a certain program that will include everything, you know, which includes agility, conditioning, strengthening, work on the, you know, footwork with the use of a ladder, and jumping so that you can teach the proper way of landing, okay? And that absorption, which is very important for the knee, preventing knee injury. And then comes the, you know, basketball drills, okay? And, you know, which will, sometimes we do offense and then the defense. And then when the competition is closer by, you know, let's say a week, and then competition arrives, then how we do it is like I focus more on offense and defense as a coach. So I have to try that. I have to teach the kids how to play it, not just knowing the plays, but how to play it, how to play basketball. So generally, what we do in our boat club is at 12 o'clock noontime, when I blow my whistle, everybody comes to the middle and we start with a prayer. Of course, we always need to have the guidance of our Lord, so, and then I basically ask for the volunteers and who can, who can lead us in prayer. And then that volunteer, at the same time, he or she will be the one who's going to start the program, which is the flexibility stretching program. And in our stretching program, I include some kind of a yoga, a yoga approach. And also then starts with the circuit training of jogging, running, and sprinting. So they're going to do that, let's say, for in two minutes. I mean, in 2 hours, I have to think that they can do that like in 10 minutes. Right, jogging, let's say 5 times, 10 times around the court. And then, brisk walking, jogging, and then sprinting. All right. So those are the warm up. So what it does in our body is to get our body ready. Okay, to keep our pulse rate up, so that the body will be ready for further training. And in stretchings, okay, stretchings, what it does, it's basically it improves the tensility of the muscle. All right, the muscle is the one that is stretchable. Our tendon is not. All right, just mind you about that. The tendons is not stretchable. So once you have an ankle sprain, you basically stretch the tendons on that lateral side of your ankle or the other side of the ankle, and that it become unstable. All right, so we do something like ankle strategy, like the simple tiptoeing and heel racing, as simple as that. Okay, what it does, it works on your neuromuscular muscles and your proprioceptions. So it prepares the body for that. Proprioceptions meaning your body tends to recognize the position of your body up in the air and down on the ground. Okay. So when we do jogging, running, and sprinting, this is just to really increase the pulse rate, okay, and get their adrenaline going, and then their body into like a warmer conditions for a better workout. And jumping as well. Now, jumping, the reason why we are doing this is just to teach the kids of how to land properly and how to absorb the pressure from the ground, all right? You never see anybody who land with a straight knee and ankle and stuff like that. That is really prone to injury. You want them to bend a little bit up to the hip level as much as possible. This is just to make sure that the absorption is there. And you can do different things actually for absorption, for knee joint absorptions drills, okay? And in basketball drills, we do different things, right? So we start with I always love these drills. We start with 3-man weave. I love this drill because this will basically teach the kids just to pass the ball without dribbling. In 2 passes, they're there already. The player already have and ready to lay it up, right? And also the 3-2-1, defense and offense and stuff like that. That kind of approach, I always love that because it teaches the kids in multi-directional movement, and also the passing drills. So we use that. But nowadays, a lot of our young players loves dribbling. I mean, because they idolize NBA players like Stephen Curry, who's this playing in the Nets. Okay, so those players are really, really good. So, but we do some dribbling drills also. So I allow them to do that also in the game, as long as they know what to do. Afterwards, the dribble. It's just like 3 dribbles for me. It's done. You're done. 3 dribbles. I mean, you should be shooting the ball already or passing the ball already after 3 dribbles. That's it. But anyway, so in this kind of injury prevention program, I mean, specifically when you would like to work on the agility and the neuromuscular training. What it does is it's basically prepare your body into a higher level of competitions. Okay, and sometimes I use TheraBand, stretch band to improve their speed. Depends on what you want to do actually. So if personally, if I'm going to do it like on a one-on-one basis, I could do more with this training for the kids, preparing their body and balance and whatnot for a better, higher competition. So any questions so far?
Yes, Coach. Say, Coach Ashley, Coach, may question for you, Coach.
Yes, sir.
Doc, Coach,
Coach Liz.
Doc, Coach. In this time of pandemic, all of us is in online setting. Can you give us at least one or two things to do, especially on injuries and strength and conditioning? At least the coaches or the players are in this time of pandemic can watch on that, and there's still that relevant and communication between the coaches and players.
Yes, that's one thing is very important, Coach Ashley. Is because you have a relationship with your players. Just like what we do here is we ask everybody how they are doing and whatnot. That we are hoping that they can do some physical activities during this pandemic. I don't know in some areas in the Philippines, because you have like what, GCQ, ECQ, a different kind of queue. So depends on the availability of your area, what you want to do. But in your own home, you can do something, especially if you are mending an injury. Let's say an ankle injury that keeps on bothering you. All right. So you can do some ankle strategies. All right. If you have what we call a wobble board or any types of ankle strategies, equipment that you can use in order for you to strengthen your ankle, just to mend that injury. Let's say if it's already a month, so you should be able to do some squatting, some jumping, or do jumping ropes, okay, or high knee, just marching in place, okay, and then kick butt and stuff like that. So that depends on the injury that you have, which limb and which joint that you can do. Now with the knee, okay, you can do like a wall slide. All right, you can do a wall slide, and then with your knee bends and stuff like that. You can do pushing your knee. I mean, weightlifting and whatnot. So you can do many different things. Now, if you are able to go out and jog or run or sprint in your community, go ahead and do that. If you're able to, if you're allowed to go out. The most important thing is you are doing physical activities. You're not just sitting around, because if you sit around, that's the worst thing that you can do as an athlete. So make sure as a coach that, especially somebody who is your player that is mending an injury, make sure that you get in touch with them and stuff like that. They can go to YouTube and look for a specific program, for that specific joint of injury that they have. So they can do many, many things, and it's available now. If they don't have Wi-Fi in their home, but probably they have a phone or some kind of communication. All right, or even you can just write them a letter if that's the case, right? And give them some list of things to do. Okay, it is very important that all the players have some kind of physical activity of what they want to do. All right, now here in our area, we can basically go out now. We can shoot around in the park. So I mean, we tend to do that at least 3 times a week. All right, so at least 3 times a week. So you kind of need to perform some kind of strengthening and cardio, like jogging or biking or whatever you want to do. Okay, I don't know if the swimming is pool is already open in the Philippines, but here pool is not that really not in operations right away. So, did I answer your question, Coach Ashley?
Thank you, Coach. I hope the listeners are get that things kasi talagang kailangan po yung sinabi niyo, Coach. At least simple materials they needed. And okay na okay po.
Yeah, I wish that I could.
Follow up, Coach.
I wish I could
Yes,
have sent
Coach.
you. I mean, I could present you a copy of some activities, you know. But I was just due to my time constraints, I was not able to. But you know, later on, I will be able to probably email everybody about the specific program, and then injury prevention program, and then all the different drills that you can do at home or community.
Yes, Coach.
Thank you, Coach.
Coach, follow up.
Coach Rain? Sige,
Release
Coach.
natin ang contact.
Coach Ashley, go.
Sige,
Sige,
Coach.
Coach.
Gusto ko lang malaman, Coach, 3 days from now, the bubble will start. NBA.
Say it again.
Coach Dudes, the bubble will start in 3
Yeah.
days. Who's your take on the NBA season?
What's my take? I mean, which team that I'm rooting for?
Yes, Coach.
Lakers.
Yes. Let's go, LeBron. Thank you,
LeBron
Coach.
ako, LeBron. Thank you.
Thank you, Coach Ashley. Coach Rain?
Hi, Coach Dudes. Good evening po.
Coach, when I can hear you well.
Coach, sa preparation po, aside from eating salt, what are the other basic preparation can you suggest for our player when we are about to have our series of games, short period of time, parang mini-league po or one-day league lang?
Coach, I'm sorry, I cannot hear you well. Okay.
Coach, about the preparation po, what aside from eating salt, what are the other basic preparation po can you suggest for our players na we are about to start our games or series like mini leagues or one day?
Are you talking about nutrition, Coach Rain?
Yes po.
Okay. Normally, what we do for our kids is I have them hydrate themselves, right? I mean, you know, hydrate with just a normal water and stuff like that. Now, for some kids, I also say that I don't know if Pedialyte is available in the Philippines. These are with different vitamins and ions. I also ask them that to do that at least a bottle a day and stuff like that, and focus more on protein. So it could be meat or it could be beans, whatever is high protein. There are some protein drinks that you can also take and stuff like that. But that depends on the age group of your players. Are they adults or are they high school or?
Coach, ang bracket po is 5 to 20 years old po.
Okay, 5 to 20 years old. All right. So
Yes.
so that depends on kasi the younger your player is, don't care about eating. They will eat whatever they eat, right? We cannot say for them to stop eating rice. No, they need carbohydrates. They burn it easily, So for me, if I'm going to eat rice, I'm going to be balloon. So for these players, you can feed them, especially with your older adult player, like 18 to 20 years old. You just have to focus on the balanced diet. They needed that. They needed high protein because they're very energetic, and always hydrate, and then the salt is just like, you can do or you cannot do it or stuff like that, but just have it ready, because sometimes when they have cramps, that depends on the severity of the cramps. It could be just one calf muscles or two calves muscles, or sometimes the hamstring cramps, or sometimes the quadricep cramps and stuff like that. So at least you have it. I mean, so you can, basically retain the fluid. You see how we the fluid that we consume. I mean, if the player is not hydrated, you will see that right away. You know, because they sweat too much or they're losing a lot of fluid, so they need to make sure that they are drinking enough fluid for that.
Coach, last po. Is
Okay.
banana advisable po eating po during game or before game po?
Well, basically before the the practice and performance, you want your player to be ready, including the nutritions or eating, as you said. Now, if the game is like 5 or 20 minutes from now, you shouldn't be eating anymore. But sometimes there's a people will eat just like a power bar. And that is good. That is good. But you should be ready. Your body and then your stomach is ready already, because one thing that you can do, it could limit your performance if you feel something unusual or some discomfort in your stomach if you eat a lot. I remember that I have a boy that's during the game he stepped outside. I just saw him walking out of the gym. This is during the game, and he said that he was so hungry. So he has to eat. So things like that. Kids will do whatever they want to do. But that is just like something funny. I didn't really, I didn't get mad. I just laughed and say, well, how come you're so hungry? You just ate. I mean, what time did you eat? So an hour or two away before the game, I mean, you should be ready, and you should, you
Coach,
should have
banana po
ready
ba
stuff.
advisable?
Oh yeah, definitely. Definitely. So those are the things that the nutrition that you can bring during the tournament. That should be available. So food, banana, fruits, and stuff like that, whatever stuff like that. So they said, but if you eat banana and then you still have cramps or whatever injury, it's not the banana's fault, right? You should be eating that long before the competition. It's not, there's no magic wand to treat your injury or prevent your injury. I mean, it's just the only how you prepare your body, physical wise, mental wise, and then all nutrition and whatnot. So kasama din yan sa discipline ng mga players.
Chocolate, coach.
Coach,
Yes, coach. Minsan di ba? Minsan, yung ibang player, marami ng kinain, tapos laro na. Minsan, naglalakad na. Bigla silang mga nahawak sa tagiliran nila. Yun yung mga nangyayari minsan, di ba, coach?
Yeah, because what happens? Yeah, what happens is like when you eat, all right, the body has this natural ability to digest it. So meaning it requires a lot of blood flow in that area. So I mean, you may not have enough blood flow in your legs or hands or brain. It's right there. That's the reason why pag busog ka, inaantok ka, right? I mean, you feel sleepy when you are full. Stomach. So that is the case. It's just because of the during the digestion process. So you should give enough time to digest your food prior to participating in competitions, especially if it's a high level competitions. So.
Yes, coach. Thank you, coach. Okay. Reminder 1 hour before the game, dapat nakakain na kayo. Hindi yung ilang minutes na lang para maglaro. Para maganda yung performance natin.
Right.
Okay. Coach Enrico?
Coach, what is actually the difference of the injury of the high and low ankle injury, and which is much worse for those two, and how long will that cure, or who is much longer to get cured for those two types of injuries, coach?
Yeah. So what is worse? What is worse is just when somebody rolled his ankle, basically upon landing or change in direction. So what I do is I try to perform my ocular inspection. Where is the swelling right away? Is it above the ankle, like your lateral malleoli? That is the bone that is in your ankle. All right. So if it's above, that is a high ankle. high ankle injury. If it's below, I mean, the swelling there, that is just a low ankle. Now that depends. If it's just a grade 1 and minor injury, again, what I said a while ago is you apply ice, let him, be out of the game, let's say for 3 to 5 minutes, just keep on icing it. And then I perform, okay, let's go outside, pull your player. Now, if I'm not coaching, I pull the player out to the sideline and I have him do jumping, running, and tiptoeing. All right. So I have him run, and if I see him limping, you're not going back into the game. So it could be a high ankle or a low ankle. Now, depends on the type of injury. If it's just a minor one, then both can be cured, basically. So, but if it's a major one, if you see there is a torn ligament, I suggest the best thing to do is just to go to emergency room. All right, but apply price always. If there is an injury, acute injury, or it's just happened, okay, apply the principle of price. So protect it, put a brace, and then have the player rest, apply ice, and then put the ace wrap, and then elevation. Apply that right away. Even if it's just a minor injury, you have to apply it right away. In order for the player, if it's a minor injury, that he can go back to competition without nothing, just like nothing happened. It's just very minor. And footwear, I mean, it has a lot of things to do with that one. If you are wearing low cut, okay, the possibility is like you're gonna have like a really low ankle sprain, and you may not be able to go back to your game. Depends on how much you take the pain, if it's a high cut, then it's still protected. Okay, so footwear has also have something to do with that, because it's kind of like the high cut can prevent, further injury, like an ankle sprain. It can prevent it, but it can just lessen the severity of the certain injury. So as a coach, so we always ask if it's a high or low injury. I mean, treat it as an injury right away. I mean, it doesn't matter if it's high or low. And you, at the end of the day, the coach will make a determination, of course, with the consent of the parent. If it's a young boy, if it's a young kid, right? Consent of the parent. If they wanted their player, their son or their daughter, to continue playing. But of course, it's very nice to always explain and educate the parents about playing sports, right? I mean, your child could be, I mean, can be injured in playing like this, especially if he's not practicing time enough. I mean, he's keep on absentee. The parents don't bring them to the practice and stuff like that, and they will just show up in the game. And you don't know what that player did during the week. If he prepared himself, or he just sit down on TV and play the video games, and then here you go, show up in the game, and then what can you do? And there's just an injury. All right. So, but at the end of the day, it's still the coach's decision if you're gonna put the player back in the game.
Yes,
So
coach.
the
Thank
high
you.
or low ankle sprain, you have to treat it as an injury. So you always treat it with the principle of price.
Thank you, coach. Thank you so much, coach.
Okay.
Coach David.
Well, good morning, Coach Dude.
Yes, sir.
How are you?
I'm good. Thank you.
All right, right. It's hard because there's so many questions that I have as a coach, as well as a dad with a 14-year-old. So let me focus first on this: the puberty time, the time when they're doing their most growing. Is that the time that we're seeing, excuse me, more injuries in the youth, especially for boys, because of that imbalance of hormones and also the growing pains as well? Maybe the muscles don't respond back as quickly. Is that the time that we're seeing that, the 12, 13, 14 age bracket? Or is it, just generally all the above?
Yeah, there was a study that came out from Mayo Clinic like a year ago about that. I mean, the age group which has more injuries. Okay, so you're right about that age. Is 14 to 16 is that's the puberty scenario of
Okay.
young player. Okay,
I
now
see.
there's more injury there, especially if they didn't get any training and conditioning and prevention training when they were like younger. Okay, so it is advantage that we start our player at a young age.
I see.
As young as 5 years old, we do that, of course, but it's not too late. It's not too late yet, because at that age, Coach David, the game of basketball is more intense than their younger counterparts, right? So it's more intense than their younger counterparts. So they have more. You see a lot of players that has changing in direction, and they jump. They don't care if they're land or not. They jump as high as they can, and here comes the more. In other words, they're more physical at that age.
Superheroes.
Exactly. Yeah. So things like that. Yes, injury is more on the level of as we get older. Okay, so it will be best if before the actual competition is they have a months of training, not just offense and defense, but basically drills, agility drills, all these sports injury prevention program that we were talking about a while ago. So if they have that one before the competition, I mean, that is just to reduce the risk of injury or being injured.
Okay, awesome. Well, I have an observation, and then I'd like you to address this. One of the things I see in the Philippines is we have basketball 365 days a year. There is no day off, really, except for if the coach is kind and gives them a rest day. And of course, other countries, that's not the case. So there's actually a period of time where they can do something else besides basketball. Actually go to a movie or play some badminton or something else. There's not a whole lot of cross-training going on. And so, but what I've seen is that there's a trend, and I don't know if you've seen this, that there's more injuries that are actually not really being seen until they get into high school and college. And all of a sudden they're seeing that these kids they've got so much scar tissue that they can't develop themselves beyond a certain point because their bodies have been damaged because this long-term no rest periods. So what do you think about that? Is that something that is on your radar screen as well?
Yes, Coach David, there is a term that we use for like overtrained or overuse.
Yeah.
All right. So our body has the ability to heal. Okay, to heal itself. So if you are doing the training and playing 365 days in a year, you're not giving your body a chance to recuperate, to recover. Now there's one thing that is now up in the market right now. It's called the cryotherapy, that you get into this unit.
Oh, okay.
Always good to help your body recuperate. So football players does that. They submerge themselves into the tank of ice. I think NBA players is doing that too. After
we've done that since I was a little kid. Yeah, that's true.
We don't do something like that. Yeah, we can basically overtrain. All right, that's why, and it can basically overtrain is basically a risk factor of injury as well. All right. Now in the U.S., based on the pediatric sports medicine, the kids, we encourage the kids to play multi-sports until they're like 12 years old. All right. So when they're 12 years old, they can focus on which sports they really would like to play and stuff like that. But again, there's only like seasons here. Like, high school have basketball they are like a winter season. So there are some kids in high school that play football in the fall or lacrosse in summer or stuff like that. And then winter basketball. So multi-sports also, but so that depends on the kids. So overtraining and overuse of muscle is real, and it can basically provoke for, injury.
One last quick one.
Yes, sir.
You recently heard about Steph Curry's surgery that he had, and so this is why I brought up the question, because here's a a superior, top of the line athlete who all those years of injuries, and of course, before he became an NBA player, you didn't really know that he was getting these ankle rolls and stuff like that. But then all of a sudden, it's affecting his career. And finally, we heard about this doctor who found the scar tissue. And thankfully, he was able to remove that scar tissue. And now, of course, Steph has much more mobility in his ankles, and he's not. But, for a long time, he had to wear not just high top shoes. He had to wear a separate ankle support inside the high top shoe, separate because of that. And, of course, that affected his mobility and ability to move with the ball left or right. And so, that's why I brought that up, because, I'm concerned about players who may not have access to a trainer or therapist like yourself. I'm thankful for therapists like yourself, because I'm sitting here today actually able to walk because of men like you and women like you. Because, I was in the military, I was in the special operations arena, and, I broke my back and I didn't even know it. I broke my neck and I didn't even know it. So you're talking about somebody, these guys, they hurt themselves. You see the superior superstars, like LeBron James, if, he gets a groin injury and pop, there it goes, and he's still playing. Like, what? What we hired to do? We're no, whoa. So anyway, thanks for being here with us today. I really appreciate it.
Thank you, Coach. Thank you, Coach. Coach, we have a question here from Coach Marlon Parahinogs. He said that SMR, or self-myofascial release, or using treatment of injury.
Yes, the soft tissue myofascial release is basically an effective approach to if there is a tightness in a particular muscle. It is a form of manual therapy that we use. Now there are different method now that basically same as the soft tissue myofascial release with the use of different tools. Okay, so it is basically effective, and there is a science and evidence that it will really help the muscle, to address its tensility and then the movement of the muscles. Just like if there is a definite scar tissue, if it's not operable, so you can use something like that.
Okay, Coach. Coach, how about massage?
All right. Now, in physical therapy, what we do is some form of massage is called a deep tissue massage. Okay. Now, myofascial release is also a manual therapy that we use. Is some kind of deep tissue massage. Okay. So if there is like a muscle contusion, let's say in the thigh area because bumping of the knee, or somebody need your player, all right, on the knee, on the thigh muscle, quadricep muscle. Okay? So you ice it, and then we apply a little bit of kneading massage. All right, we call it a kneading massage. I mean, you apply it with your thumb and just do a circular movement. Okay. And also what I use and the physical therapy widely use an ointment called BioFreeze. Okay, so we do something like that. Yeah, so we apply this deep tissue massage and then apply a BioFreeze afterwards. And hopefully that the player will be able to perform without having discomfort while running and jumping or playing the game. So this is a game you can do something like that. Now, the relaxation massage is different. We don't give something like that.
Thank you, Coach. Coach Ashley.
Coach, you said earlier that before turning to be a coach, you're a parent of a player.
Yeah.
Then you become a coach. What advice can you give us through a parent-coach relationship? Because nowadays, especially for young kids, most of us experience some parents shouting outside the court, telling us what to do. What advice can you give us to a parent-coach relationship?
I think you're setting me up.
I will not put you in the spot, Coach. I will not put you on the
No, it's it so happened that I have a good relationship with my kids, of course. I make sure that they know that I'm the dad first before I'm a coach. So I kind of like tend to explain to them the boundaries. Okay, so when we are like in the basketball court, I am the coach. I'm not your dad. Okay, so when we're home or somewhere else outside the basketball gym, then I'm your dad and stuff like that. So, and I always encourage them to take leadership. I train them how to be leaders. All right, so to make sure that you become a model to your players. Okay, I'm not saying that you are the best player because I use you, you know, and then I put you in the bench as well. You know, as a coach, I make sure. I mean, you know, that it is my my intention to play everybody. If I have 15 kids, I'm gonna play everybody. You know, what of course with the different minutes. Okay, you want to win. You use your best player. You know, if your son is one of those best players, so you use him, right? So they always say that there's favoritism because he's your son, so you use him a lot. I mean, you know, there's always an issue like that. All right, so we see this all the time, coach, and then your son in one team. You see that in the NBA. You see how they handle it. That we grow up like that, though. For the kids, it's not easy because they see you as your dad first before the coach, right? I mean, you know, kids younger than 12, so they see you as your dad before you know, coach. But you know, if they're like, you know, above 12, 19, 20-year-old, all right, so they understand already you as a coach. So with the younger kids, you just have to take it easy on them and stuff like that and stuff. So I would advise the parents, especially if you're coaching your kids, just to make sure that he levels up with the team, that he's doing what you want him and the other players are doing on the same playing field, same and stuff like that. So I mean, if I have a choice, I would rather not coach my son.
Coach, how about the parents of other players?
Parents of other players.
What's your advice for us for that relationship of other players?
For are you talking about the coach and the parents of your
Parents of
now?
yes.
What we do in that is really effective is communication. So what we do in Familia Washington D.C., we set our own group me type of communication on each division. So there I communicate what I would like them to do and what I would like them to see. Never discuss about the minutes. I mean, you know, I don't discuss the minutes of playing with the parents. Okay, but sometimes we discuss it when we travel to Canada and I have 15 players. I discuss this with the players. I may not be able to play your son in this game, okay, but in other game I may be able to play him. I mean, you know, because you know you have to consider that they're going to travel. And then they're going to spend a lot of money, and they don't want to see their son just sitting in the bench. All right. I mean, you know, sometimes they will not, you know, maybe say it in front of your face, but they will just disappear, just like saying it that you're a bad coach. You don't use my son. So I mean, I understand that. I have experienced that before. So you know, I'm just going to take it professionally. All right. Now. Thing about it is like for me to use your son in a game, I need to see him how he performs during practice, you know. But it is always our intention to use all players as much as possible. Don't bench anyone, especially the young kid. It's disheartening for them. I mean, it's not good life experience for them and stuff like that. Although you have to make sure that you give a pep talk, you encourage them, you know, and stuff like that. So I talk, the only things that I talk to my parents is, what do you need to do? What do you need to bring? Ready your player. Make sure when he comes to the gym, he's ready. He's not on slippers. You know, I don't want to see anybody just putting their socks or their shoes on when they come into the gym. They have to be ready. So I tell that to my parents because this is part of the discipline. I mean, you know, you have to make an impact to the kids today that they can carry on, throughout their lives, right? I mean, that's one thing that I would like to impart with my parents and my kids. I mean, I'm making an impact with this kid's life, make sure that they're disciplined also at home. They're doing what you want them to do. So I had this parent before that I told my kids not to drink sodas, right? So this parent told me that every time he asked his child to drink soda, he will say, "No, Coach Dudes don't want me to drink soda." There you go. So I'm making an impact to the kids' life, right? So things like
Yes.
that.
Yes, coach. Thank you, coach.
Thank you,
Coach
Coach.
Enrico.
Yeah. Well, Coach, could you share to them our experience about when you try to help rehabilitate Andre's injury, regarding about like same injury that like uh, Paul George has, as kind of
Yeah,
severe injury. When we cured that, that was
yeah,
a major
yeah. Well, one of my thing as a coach and as a trainer is my relationship with the players, as I mentioned a while ago. So I make sure that they're doing okay, especially those who are injured. So I visit them, on my own time to their home and do some kind of physical therapy. Okay, so this player of ours didn't get injured in our own gym. He was playing somewhere else when he got injured. So during his recovery time, I talked to him, I visit him, and started walking him with the crutches, non-weight bearing. He cannot put weight on that leg because this is like one of those freak accident like Paul George has, fracture of your tibial bone. So that he said that he was uh, trying to, run after somebody to block the shot, and then he landed awkwardly, broke his tibia, like in the midsection of tibia. So this is like what Paul George has, if you've seen this injury. So basically, after that happened, so I talked to him. He said he's going to have surgery. So I communicate with the doctor. So I told him that I'm the private physical therapy for this person, because you're going to need consent from the doctor that he can start physical therapy, which I know that he can, basically. Having a doctorate in my degree is basically, I don't need permission from the doctor. I have an independent practice that I can go ahead and see. The only thing that I cannot do is prescribe medications, right? But I can suggest over-the-counter medications for pain, like, ibuprofen and acetaminophen or Tylenol and stuff like that. So well, anyway, so I started him. Our week one was mostly isometric exercises. This is like contracting the muscles without range of motion, without moving the joint. Anyway, so we start that in his bed, and then our week two, we focus more on walking. So I asked the doctor, when can we start weight bearing? And that weight bearing started on that week two. So I started him, with a crutch, double crutch, putting his injured foot on the ground with a proper gait training pattern. And then the third week, we started walking outdoors. We started going up and down the steps, because they live in an apartment with lots of stairs, 21 steps, I guess, if I can remember. But anyway, so we did that, and then we walk in the community. And I told him to continue with his outpatient physical therapy rehab, because I don't have the equipment for the things that he can use. This is like on his phase two of physical therapy. And then, as you can see him now, he's back. When he tried to come back, like maybe after a month or two, it's like 100%. I mean, I can sense that he still have the psychological aspect that he might re-injured it and stuff like that. So I just keep on talking to him, improve his psych, that you can do this, you can do it 100%. I talked to your doctor already. He x-rayed you, the bone is healed, and you're doing some weight training already. So right now he's 100%. Actually, I was hoping that he can play in MPBL because this
Yeah.
guy is really skilled and he's really a good player. But anyway, so he's 100% now and he's back. So that's what we did.
Yes, coach. That's great, coach. Coach, when it comes to psychological, coach, because most of some of the players, they already healed their injuries, but they're always thinking about it. What can you say about it, coach?
Well, basically there is psychological aspect of injury, especially if this is your livelihood. You know what I mean? Now, if this is just like you're playing the game recreationally, you will just play it. You will just play it. Maybe you don't have this mindset, but as long as you follow the proper way of doing things, that you do some exercises, strengthening exercises, that you wake your way up, going back to 100%. It's always like that. Psychologically, I mean, you can only beat that when you start playing again. All right.
Yeah.
So not everybody who had history of injury basically back 100%. Unfortunately, not everybody can go back to that. This is kind of like a PTSD, post-traumatic stress syndrome. So they're gonna have that one. So you just have to beat it. I have not really focused on the psychological aspect of sports injury yet. I'm reading on that one because I would like to see it. But basically, because of the kids that I'm just working on right now, you can see the knee or the ankle is still swollen. They would like to play right away. I mean, so kids are, indispensable. They would like to play it. I don't care if I have injury and stuff like that. I mean, so there are some NBA players like that too. But if you are like a professional athlete, basketball athlete, your body is your investment. Your body is your investment, so you have to take care of it. So if you have an injury, you still have to see a psychologist, a sports psychologist, to make sure that you are 100% up here also. So
Thank you, coach. Thank you, coach. Last question for me. What can the coach, for some of the teams have what you call the physical therapy in the team, what advice then you give to the coaches or the parents or the teachers that handling a team, coach?
advices for what again? Sorry, I didn't get your question clearly.
Yes, coach. And your advices, coach, for those who are listening or for those who are coaches and teachers that has no coach physical therapy in their team.
Okay, right. Okay, so lucky are those teams, right, sports or amateurs, that they have access to physical therapy or strengthening and conditioning, coaches and stuff like that. They're really lucky to have that, but not everybody is on the same, playing field when it comes to our situation financially and whatnot. So if you don't have anybody, I mean, professional physical therapists or athletic trainers and whatnot in your team, what you can do is basically have a parent. Okay, have a parent. Either it doesn't matter kung ano yung profession ng parent. Have a parent to look into or to study and educate himself or herself to sports, anything about sports injury program. So there are many things that you can do. I mean, go online, you can pick that up, and then go on YouTube in order for you to learn some different drills. Sabi nga yung coaches pare-pareho lang yan. I don't believe it's pare-pareho lang. I mean, they're all the same, David. I mean, I don't believe that they're all the same. Depends on your program, if what you want to do. So I advise them to educate themselves, even the coach. All right, not just focus on the plays, the offense and defense. I mean, you need, as a coach, we all need to educate ourselves too. All right, so when it comes to injury during during the game, you need to have a parent that will carry a ace wrap with them, or whatever bandage that you can find, ice pack, or at least an access that is, or know a store where you can get an ice pack, okay? And then, and hopefully there's no injury will occur during that time. But in case there's you need to educate yourselves. Just try to remember the principle of price, and it cannot go wrong. You can never go wrong about that. If there is a major injury, I mean, you know, apply price, but make sure that you go and see the doctor. If you cannot see the doctor, you take your player home and you treat it there at home. Okay, focus on ice pack for the first 24 and 72 hours. All right, and then you can do some exercises. As I have mentioned a while ago, as a coach, we need to have a personal relationship with your players, you know, by visiting them, calling them, talk to their parents and see how they're doing and whatnot, stuff like that. I mean, you know, make it as a family thing that you are in this together so that you can go back to the same, you know, to the game right away. So try to educate yourself with sports injury. And I mean, you know, you don't need to be a physical therapist to understand it. There are some simple ones that you can basically understand, you know, when you research it. And the way, if you are not, you don't have the knowledge of how to wrap it, all right, there is, you can go to YouTube of how to do some proper taping. And if kinesio tape or athletic tape is not available, you can do an ace wrap. I think that is readily available anywhere anyway. I mean, you know, so make sure that you have that, and make sure that you basically give proper nutrition to your players. As a parent, of course, I mean, you know, it doesn't matter what you feed your children, but just feed them, you know, on a proper time basis. I mean, you know, lots of fruits and lots of water and stuff.
Yun. You heard it.
Thank you.
Kay Doc Eduard. Maraming salamat, Coach. Any more question, coaches? Yes.
Coach,
Yes,
ako
Coach.
hindi tanong.
Go ahead.
Si Coach did mo.
Yeah.
Yeah, Coach. Go, Coach David.
Okay, this one relates to compression shirts, shorts, and socks, and all those things. Do you think those help in preventing injury?
Oh, basically, this is what I call, Coach David, this is what I call necessities, right? These are just necessities. What it does is compression sleeves,
All
compression
that,
stuff like that. You see those players are doing it and stuff like that. But this is basically the compression. It can basically help in the temperature of your muscle. The temperature of your muscle. If it's too tight, it can basically prevent some good blood flow, which is the one that you like, right? So you don't want that. But if you have an injury, I mean, that is basically will be helpful, especially if you still have weakness on your muscles, and then maybe a little bit of swelling. You can do something like that, and to protect, you know, to protect your previous injury. If you do not have any injury on the limb, wrist, or things like that, those are just necessities.
Okay. So thank you.
Thank you, Coach. Bibili pa sana ako. Coach Ashley.
Coach Meg,
yes, Coach.
A question. Coach Ed, it's not totally a question, but a takeaway for today's topic. For us coaches, especially teaching 12 years old below, it is important for us to teach the basic of jumping, footwork, squatting, balancing, and movement, because if you know the basic of that, Coach Ed, at least 90% of our players are preventing injuries, especially when that 12 years old go up to a higher level of competition, when they become high school players, then they know the basic. Injuries naman, andyan naman lagi. At least they know the basic of this prevention of injuries. So it's up to us coaches for us to teach them the proper way, especially the balancing, the footwork. Coach Ed, what's your take?
Yeah, that's true, Coach Ashley. So it's basically as young as 12 years old, they need to have fundamentals of you know, the body and the balance and the movement. That's why you do these drills you make it fun for these kids so that they will come back and love the sports, learn to love them, as long as they play them, as long as they would love to. So basically, if they have that fundamentals, and I can see in the basketball, intercity tournament, those kids as young as 7 years old to 12 years old, you can see that they have all these fundamentals already. I mean, they have a tremendous crossover. I mean, even in between legs, and I can see that. I mean, how they got trained and whatnot, and that's true. If they have all these fundamentals, if you work consistently on their agility, their balance, and their footwork, basically those are the injury prevention program that you have, and that's good.
Thank you, Coach Ed.
Yes.
We learned a lot from today. Take care. God bless.
Thank
Thank
you, Coach. Any more question, coaches? Any more question? Okay. Yan, Coach Enrico.
No, I just want to have a take with Coach Rain. Banana is okay, but don't make your players take that banana when they got cramps or during the game, or like about after the game. They should always had that during the practice, and biblically always eat high potassium so that they can hydrate and use it through the game. Because normally we have some players that has the same thing issues like you guys may be having. When they cramping, they try to eat the banana, then it's not gonna help anymore. You should do that before. For Coach Dudes, Coach, what is actually, what you can, get to advise like for all of our coaches here, in case that like for my just last question, in case what they will see what more type of what can you advise, like if they have some injuries for their players, because some of the parents and especially not those are really knows how to apply first aid, especially in the province. Normally they try to intend to aggravate the injuries, or trying to take some knowledge how to cure it by themselves. So if there's any injuries, like what do they needed to do for not to aggravate those injuries during the game, especially if it happened during the game?
Yeah. So during the game, the main purpose of your main intention not to aggravate the injury is to follow the price principle. So if you're able to, let me say it like this: like back in those days, we play barefooted in our province in Mindanao, right? So even that, we can still get injured. By doing that one. So in order for you not to aggravate it, meaning that just follow the price principle. And if it's too painful for the player, let's say you evaluate it and you ask him to walk or you ask him to run inside to jump, and you see it limping, that's it. Right there and then you can make the decision. Okay, you cannot play anymore. You're limping. I'm not gonna ruin your future. Let's not play. Continue this game. Move on to the next game if you're able to. If not, then you gotta continue with your training and exercises and whatnot. All right. One last thing that I would like to mention to you. I think Coach Enrico asked me this a week ago, that when can a kid start weight training? Have you asked that? You have that things before, like, at what age is the proper age to do weight training, right? If you look at that at Google, there is some advice from different sports medicine doctor that they can do it as young as 5 years old. Now, do not confuse strengthening exercises to a weight training. That is two different things. Okay, so when can you start strengthening for the kids? You can start that as young as 5 years old. Even the weight training, okay? Here's the principle. You always start, all right? You always use their body weight. Okay, let's say push-ups, things like that. Squatting, you always use that body weight. That is also a strengthening program. Now, when it comes to the weights, you always start with the lowest weight. You know, this is not like we cannot compare them as the adults. You know, we cannot have them perform the same program as the adults. All right, you can do just a pound or half a pound. I mean, you can do work on your shoulders, your biceps and your triceps and stuff like that. You can do something like that. As long as they are supervised, as long as they know what they're doing, okay? The reason why we don't do weight training for the younger kids, okay, it's because it's not easy for them to understand what they're doing, all right? The reason why you're not doing it is because maybe you don't understand what you are doing, you know? So you need to have a basic knowledge of how to do it properly, the body posture, and parts of the body that you would like to work on, okay? When it comes to their puberty, high school, that is the time that you intensify their strengthening program and weight training as well. You can see different players that use a stretch band or a TheraBand. In our case, in physical therapy, we call it a TheraBand, okay? So you can use something like that, but focus on increasing the number of repetitions rather than increasing the workload or increasing the weights. So that is just the question that always I ask, when can I start lifting? You don't want to bulk right away, you're just like 6 years old, right? So I have them use the TheraBand, the yellow one, the easiest one that you can do. Yeah, you're gonna make it fun for the kids so that they will come back and love the sports, as I said a while ago. Thank you.
Yes, Coach. Thank you, Coach. Any more question, coaches? Ganda ng mga topic natin kay Coach Edward. Kay Coach Dudes pala, kay Coach Dudes. Okay.
All right. Okay.
Yes. On behalf of the coaches, Coach, maraming salamat, Coach, sa i-share yung knowledge to our viewers today. And before we end, Coach, I would like to thank all our sponsors again. And Coach Ariel, Vanguardia, whose Coaches International, Blackwater Elite, Medallia Sports Clothing, Familia Washington, kay Coach Enrico Quintana, Cougar Sports Dubai, Instant Gab Consultant. Maraming salamat sa mga sponsors. And also, happy birthday to my mom. Yan. Happy birthday.
Happy birthday.
And before we end, Coach David.
Yes, sir. Let's pray.
Yes, Coach.
We're excited, Lord, to come before you. We thank you for this discussion today, learning about the body and its recovery and its prevention of injury, Lord. But we thank you that ultimately you're in charge, Lord, of the healing process and helping us develop our bodies and the bodies of those wards that are entrusted to us. Lord, we ask you to help us to continue to learn and to protect those that we care for. We ask this in Jesus' name. Amen. And amen.
Amen.
Maraming salamat, Coach.
Thank
Coach
you.
Dudes, maraming salamat. A lot of learning for today. Thank you, Coach.
Thank you.
Bye, all.
All right, Coach Dude.
See you again.
See you again.
Hey, Coach Dude, if you got
right,
that stuff, you can post on our wall there, such as your price acronym, you know, things that we can share so that.
Oh yeah, I will.
I
will do that.
We have our
right.
we have our messenger group, Coach.
Yeah.
You can send it to our
awesome.
group. Thank you.
All
Coach.
right. Hey guys, it's good to see you. Hey, and Coach Enrico, you got to teach me how to make that nice backdrop in the back.
Yeah.
You know, I think people are tired of seeing my curtains.
There's a secret. Don't worry, guys.
I want to know. You got to teach me the secret.
We can talk now, Coach. Send
it to us on that same page.
Hindi na tayo naka-live. Pwede tayo mag-usap na, hindi na tayo naka-live ngayon.
Okay. So si Coach Rain, you're in Bacolod?
I want you to see my refrigerator.
Marikina po, Metro Manila po.
Marikina. Okay.
Yes, po.
We used to live there in Concepcion.
Thank you, everyone.
Kami po ng
The Brady Bunch. The Brady Bunch. That's who we are, Coach.
I played there in Interbarangay, dun sa Marikina Plaza.
Opo.
During our time, maybe hindi ka pa pinapanganak nun.
Opo.
You were not born there yet.
Kaya, Coach, nawala na yung background ni Coach Enrico, Coach David. See it?
Ayun.
Nandun lang siya.
That's why I use that background.
Yeah, you got to teach us how. I want to go to the Grand Canyon, okay? It's been too long.
I mean, right now they have a lot of the COVID there is so high.
In Bacolod? Oh,
No,
don't
I
want
mean
to
here
talk.
in Grand
Oh,
Canyon,
oh,
in Arizona.
oh, yeah.
In
I heard that in
Nevada.
Yosemite Valley too. I was like, what?
California
What's
is
going
number
on?
one.
I think